Health will come to order. Please join me in pledging allegiance to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Next, we will consider the minutes of last month's meeting, February 22nd, 2011, which we all got via email. I'll entertain a motion to approve the minutes. Thank you. Is there a second? Motion has been made and seconded. All in favor, say aye. Aye. Any contrary? The minutes are approved as submitted. Thank you very much. We'll move on to announcements. Before Mr. Taltone gives us his announcements and health officer's report, let me take this opportunity to announce that immediately following this meeting, or at 6:00 p.m., if that comes later than the conclusion of this meeting, there will be a meeting of the Board of Commissioners Subcommittee on Public Health. So that will be almost immediately following this meeting. The subject matter will be the proposed revisions to Chapter 115 of the Township ordinances, which deals with animal control. Okay, Mr. Taltone, I'll ask you to provide us with your announcements and health officer's report. Thank you.
Thank you. Good afternoon, board members. Before I get started, I wanted to let you know that Dr. Elan Ballard, for work reasons, could not be here tonight. He had to cover for another physician, and board member Kelly Doyle was not able to make it. Her son had an injury she had to attend to. For the month of February, I have to apologize to the board before I get started. When I was doing this report last week, I sent a bunch of emails, kept putting the dates wrong. I was a little bit off balance last week, so I have to apologize for that. For the month of February, we were able to do 21 food establishment inspections, 8 bathing places, 5 citizen quality of life issues, a couple of dog bites. We had one of our police officers who was bitten by a dog, and another human civilian who was bitten also. We had some complaints of rats, and I had a couple of sanitation inspections or complaints in food facilities. During the month of March, it was colorectal cancer month. We put out a bunch of flyers. Some of them are still out on the desk for residents, urging people to get checked and screened for colorectal cancer. That's one that's pretty near and dear to me since my father had it. So we were vigilant in that. In your packet, you'll find a reports from the Volunteer Medical Services Corp. From Lower Merion and Narberth. They actually respond to Radnor Township residents in emergencies. They're ambulance. We used to put this in our packet before, and one of the previous board members said that we should discontinue it. The manager thought it would be a good idea if I, reinsert them and let this board decide whether or not they wanted to have these in the packet in the future. So that's the purpose for those. Just so that you know what's on the horizon as far as upcoming events, we're looking at the annual Mainline Jazz and Food Festival, June 11th this year. Same location, North Wayne Avenue between Lancaster and West Avenue. Katie Sampson Lacrosse Tournament at the Radnor High School, April the 30th, 2011. And in your packet, you'll find information regarding similarly related Dogs are large SPCA closure, along with the usual health alerts, advisories, and updates from Pennsylvania Health Alert Network. We had two, which was February 17, 2011, update on influenza for surveillance testing and reporting, and March 3rd, 2011, pertussis in Berks County. So ends my report.
Just a quick question, on up and coming special events, the lacrosse tournament, Katie Sampson lacrosse tournament, and the mainline jazz, are those fundraising events?
Not for us. They're more community-based events.
Okay, thank you. They're certainly both wonderful events, and I've enjoyed in particular the 2011, the Mainline Jazz and Food Festival in previous years. Okay, any questions for Mr. Taltone? Hearing none, we'll move on to old business. First item under old business concerns the Delaware County Department of Public Health. Actually, that should be proposed Delaware County Department of Public Health. Where we left that last month was that we had access to a report of a feasibility study conducted by the Drexel University School of Public Health for York County, and as reported at that time, although the Drexel University did in fact recommend that York County establish a countywide Department of Public Health, York County had not moved on that, and at that point we did not know why, and I charged myself to take on trying to find out why, and I contacted some people who were involved with who were working in York County in public health at that time, and still are, and asked them what happened. And basically, I think I would characterize the responses I got as the opinions of the people I asked, that there was some political problems that they hadn't managed to overcome in terms of establishing a countywide Department of Public Health. And that's, again, I want to stress, that's probably the opinions of the people. Whether that in fact was the overriding issue as opposed to any other considerations, it's not really possible to determine at this point in time. Nevertheless, we did have some information with regard to the movement of our own county with regard to that issue, and we got some material emailed to us. Mr. Taltone, would you just take a minute and where did that come from? That looks to be like an online blog, or is that where that came from?
What piece of information are you referring
The
to?
Philly.com, Delaware County taking steps to coordinate public health efforts. I just want to make sure I understand the source of this.
It was in the Philadelphia Inquirer. And
Yes, it was, and I got it
Yeah.
offline, but it was a Philadelphia Inquirer
I see.
article.
Okay, because mine looked like it was, it says posted on Friday, March 11th, 2011, so it looked like somebody's blog. In any case, the headline is Delaware County taking steps to coordinate public health efforts, and this action takes place a little over a year after Johns Hopkins University School of Public Health reported to Delaware County, the county council in particular, that there were some issues with regard to the health of Delaware County residents. And although they did not indicate specifically or recommend specifically the establishment of a countywide Department of Public Health. It's clear from their report that many of the issues that they've identified would be in that area, and many of them could, in fact, be amenable to remedy if we had a Department of Public Health for the entire county. So the county, according to this article, said that they are going to try to remedy some of the problems by hiring a senior medical advisor to help coordinate public health efforts. And that's a quote from the article. And there are Councilman Mario Severa is apparently the spearhead in this effort. And so that's an effort that is underway. The article also cited the work of the League of Women Voters and Rosemary O'Malley Holt, who spoke to us here in this room last year with regard to the concerns that that group has with regard to the establishment of a countywide Department of Public Health. So there is some movement, although not entirely in the direction. Meanwhile, the township, as we've reported, has sent a letter to county officials informing them of the Board of Commissioners vote by a margin of 5-2, recommending that the county establish a countywide Department of Public Health. And Mr. Nagel is quoted as in this article as saying that we have not yet gotten any feedback. So that's essentially where we are at this point on that issue. Does anyone have anything to add to that? Okay. Ms. Mosier-Mills, do you happen to know if Dr. Leader is coming this evening?
She said that she wasn't going to make it.
Not to this meeting. Okay. Can you report the progress we've made on the teen health issues in the last month?
Yeah. I think it was about 2 weeks ago. They came to Radnor High School, and we went through the halls and interviewed students, asking them questions that I had come up with about the health issues that we were focusing on, and those were sleep, nutrition and exercise, and access to health care. And so we asked them questions, and we gave them permission forms to give to their parents to let them know what they had been filmed for, and if their parents had had any issues with this, they could call. And currently, they're going to edit it, and we're going to interview some other people, and currently we're coming up with questions for those. So that's basically where it is right now.
I understand that Mr. Skellinger, the Radnor High School principal, made some announcements in the school to the students at large regarding sleep. Was that in connection with your work?
I'm not sure, because I had talked to him earlier, and that was, I think, 2 days before we filmed, so I don't know if that had any connection, but it came the same week that we filmed, so maybe it did.
What were those announcements? Because since I have a child in 9th grade, of course, I did not hear anything about this.
He just made an announcement on the morning announcements about how teenagers don't get enough sleep and how we need to try to get more sleep, and I think he gave some statistics about sleep. That was basically it.
Our teenagers undoubtedly slept through the message, so. Okay, thank you for that report, Ms. Mosier-Mills. Amy, do you want to add anything in terms of upcoming events with regard to that? I know you're going to be doing some follow-up work in
Right,
mid-April.
One of the people who will be interviewed is Dr. Bonnie Offit. She's a pediatrician at Kids First in Haverford and has a lot of patients from our area, and has been in practice over 20 years, and has been kind enough to say that she would be happy to be interviewed on this topic. So,
That's great, and that's all in connection with Radnor Health Matters, our ongoing occasional series of programs on issues that affect the health of our citizens. And this year in particular, we're looking at health issues that affect our teen citizens in Radnor Township. Ms. Burns, would you give us a report on the Environmental Advisory Council? Thank you.
Yes. There's one thing I'd like to just bring up that was discussed about the Delaware County Household Hazardous Waste Program, that there's going to be 2 Saturdays, one April 9th and then May 7th, that there's 2 different collection sites, which I can give Allison, as far as the Household Hazardous Waste Program. And the real move from the EAC as far as decreasing our carbon footprint in Delaware County or Radnor Township is really remarkable on some of the things, especially the recycling. I didn't realize how much that the recycling has done for us here in the township. The other issue is that I did bring up with the EAC about getting their support for our movement towards the health department. I just was hoping to present kind of a grand scheme of what we were looking for, and they really wanted a lot of specifics, which I did get back to Dr. Hazen about, as far as it was just really down to the dollar, which Dr. Hazen had given us some numbers from other studies as far as like how much per person, how much per capita the cost would be. Some of the issues, though, that did come up, which also was reflected in Dr. Hawk's email, the York County doctor, is, and this was a question, is that once they had the feasibility study, is that it then did seem that they needed more money, and that was a concern, that if we went ahead with this, how much more money would we constantly be having to provide for the health department. So I told that they gave us a conditional support, and that after talking and or sending an email to Dr. Hazen, we'll go back to the EAC with some of that information plus this new information. Actually, I'll send this to Brenda from the EAC as far as this article that Amy brought to Wishner brought to our attention. So, because it kind of talks about some of the different things of looking at the different counties, and it still is very general, and I think that's the unfortunate part. We are very at such a general level that some of the questions that they asked we're still not going to be able to answer.
Thank you. Before I ask if there are any questions with regard to that, I did respond, and I hope clarified the fact that it's not possible at this point to answer the very specific kinds of questions as to just what would be the different kinds of programs and activities that might be carried out by a countywide Department of Public Health. There are some very lean departments, and then there are some departments that might be characterized as full service. And those are decisions that the county commissioners, informed by citizens in the county, would have to make down the road. And the same is true of the overall costs and the impact on possible taxes for citizens. The only thing we know is for those counties that surround us that have already adopted a countywide Department of Public Health, we know what the per capita costs have been, and that's documented. And the per capita costs are derived from what the gross costs are of running the department minus any state subsidies and foundation grants
Yes, so I went to the Radnor Reach meeting, which was March 15th. And so this was at the Wayne train station in the evening in that kind of back room there. And the sort of theme of the meeting was talking about different scenarios. What if your child, what if a parent calls you and says your child is passed out drunk and they have the child's car keys? Are you okay with that? That sort of thing. And it was it was quite well attended. I mean, I thought there were maybe about 60 people there. There was one man, all the rest women, and the one man was the principal of the middle school. So that was sort of interesting that it was all moms. The scenarios were interesting, and I thought it was somewhat helpful as far as tips and specific strategies. I thought, there's definitely a theme of any party, there's alcohol. There's alcohol everywhere. The kids find some way to bring it in. And like that. And it was just one big discussion, and I'm not the most assertive person in those kinds of situations. So a couple of times I had things I wanted to say, but, before I could say anything, 3 other people jumped in. So I did email and suggest, a different kind of thing might be to have sort of small groups because there were a fair number of other ladies there who also didn't say anything. But I thought it was good and certainly worthwhile and helpful to think about, the issues that were being raised. And, so it was, it's good.
Do you, I understand that there's a date already set for another meeting, perhaps scope of which will be slightly different. Do you have that date?
Just know it was something I couldn't do, so I'm not sure.
Yeah, I'm
that
going
I
to try and be there myself.
have that date written down.
I think it's April 5th. Does that sound correct? Okay.
Not sure.
If you could find out and email all of us so
Okay.
that those of us who want to attend the next meeting, is the content of the meeting going to be distinct from this first one?
I'm sure it will be. I don't know, because I know they have kind of a series of things they have planned. And, I give them, really a lot of credit. They're doing all this on a volunteer basis. And, they were very prepared for the meeting. They had the PowerPoint with each scenario up there and some, questions. So, it's definitely a good effort.
Do we have a sense of how, if at all, this sort of activity is going to impact on preventive activities in the middle and senior high schools?
Well, I think certainly a big emphasis of it is to encourage parents to call other parents, maybe a little more freely than people have been doing in the past to, encourage checking on things, or if you see a kid doing something that seems, dangerous to themselves or others, to take the risk of calling the parent, even if the parent is defensive, or even if, you don't get a good response, but maybe you will get a good response, and maybe you'll end up doing something that'll help the child in question. So I think it's about improving communication and, maybe for, a fair number of people there were parents who have their first kid in the middle or high school. So, so some of the people there who were more experienced had sort of helpful tips to hand off. And so I think that's kind of the focus.
Thank you. Any further,
One other thing I just wanted to add is that there was a representative from the police department there as well, who talked about what they do and don't do in certain situations, and some of the legal ramifications of different things. So, that was really helpful as well.
all right, anyone have any further questions or comments? Okay, then we'll move on to the last item under old business is to deal with Chapter 115, the Animal Control Ordinance, which again will be the subject of the meeting following this one of the Board of Commissioners Subcommittee on Public Health. And I'd like to ask Dr. Donato to take the lead on this item.
So the reason we're reevaluating the ordinance was probably about 2-3 weeks ago now. I was approached by our Township officer, animal control officer, William Gallagher, and he asked for me to come in and meet with his sergeant because the Delaware County SPCA was no longer going to be accepting animals. Well, that's going to happen as of June 30th. And one of their dilemmas was that they were retrieving animals that had been at large, and routinely they would have brought them to one of the animal care facilities in Radnor Township, or they would have taken them to the SPCA, the Delaware County SPCA, and that was more of their long-term option. And their dilemma was the Delaware County SPCA closing makes it so they're going to be stuck with some animals. And they had a nice presentation put together that to help formulate a plan for this, and they have a strategy. And it really coincided with a lot of what we had already done as a board for redrafting the ordinance 115. So I wanted to go through a little bit of what they proposed to me that their plan was, and we'll quickly see that there's a lot of overlap. They had a 3-part strategy: education of the public, which of course this board, we do a lot of that, short-term housing for the animals that they find at large, and long-term solutions. So they had a 3-pronged approach. But one of the important things that helped determine their approach was they wanted to know how many animals they had brought to the SPCA. And generally, over the past 3-4 years, they averaged somewhere around 28 animals that would go to the SPCA each year. And that doesn't sound like a lot, but you're a little over 2 a month, and it really does become a dilemma to try and figure out what to do with these animals. So they identified the number there. So what they wanted to do was, again, start with education. That was one prong of their approach, which included registration of animals, which we discussed a fair amount in our ordinance. They mentioned specifically township ordinances like leash laws and dogs at large, which we have addressed as well. They thought that along with the education, they could do some public relations through newspapers, websites, and of course, when I heard that, I thought Radnor Health Matters may be able to lend them a hand with this, and other, just again, talking about it tonight. We're educating everybody in the township. And they also thought that potentially there could be some registration within the township, so not just the county, but potentially in the township as well. The other part of their approach was short-term housing, and there's the immediate, as soon as they pick up the animal, what can they do with that, so a dog or a cat. So an after-hours facility, they wanted to look into that, and police capture and delivery, which is what they were currently doing, just the delivery spot would be different now. One of their thoughts to that was utilizing the veterinary care facilities in the township, which not only includes the veterinary hospitals, but also there's Francisville, which is a shelter in Radnor Township, and they are in discussions with them as well. They would like to also get microchip scanners, because that really gets the animal back to the house, back to the owners as quickly as possible. And they may even be able to totally avoid having to store the animal for any amount of time. They may be able to identify that right off the bat. And then they were thinking about potentially adding the lost animals to our website too, to the Radnor Township website. Some of the long-term solutions, what happens when we can't identify an owner, there were a lot of questions there. Again, coming back to discussions with Francisville, the veterinary facilities. And the question came up, what are the township responsibilities? And where should we go from there? These are all things that a committee they were starting to form hopefully we'll be able to answer. And costs, who has to pay for it, charged to the owner when the animal is returned, if there's long-term storage of an animal. Is it, should it be absorbed by the organization that helps, or should there be donations in lieu of citations? So a lot of questions that should be reviewed. They actually thought that potentially it could be handled, a lot of this could be handled like an on-call towing, which I found interesting. It actually parallels pretty well to the storage of animals in a way. From being a veterinarian, it's kind of, we don't like to think of animals as property, but they are, in essence, a piece of property as defined by the state of Pennsylvania. So this actually, if done in an appropriate way, really applies to animals as well. Just as there are many towing companies, they would want to involve as many animal care facilities. They are very interested in establishing strict adherence to registration violations and ordinance violations. The police seem to be very interested in doing that. Because for every animal, those 28 animals, if they have to be run somewhere, and the costs associated with that are quite large, and they want to kind of take care of it before it becomes a problem. It was even a significant burden to them when they were driving down to the SPCA, because you have a police officer that's gone for a certain amount of time, and there's a lot involved in that. They were also thinking, hey, do we have a township-wide open meeting, solicit input from the stakeholders? Do we establish a temporary holding facility, or do we just do nothing about it? And I don't think they're interested in doing nothing, but it was just something they brought up because it seems like the plan is, they're starting to formulate a plan. So as far as, what we can do as a board, take into consideration some of the needs now. I think we did before. I think we addressed a lot of this, but maybe fine-tuning to make sure we're including some of the restrictions that they are proposing, including the fines and the enforcement of it, and see what we can do about putting that into the ordinance. I know, again, we looked at that in detail, but communicating with Sergeant Smith and the animal control officer and see what their committee has come up with in making sure that those things are represented in the ordinance. I think those are things we can do. I think that we'll be able to help also with the education of it. And as they establish a plan for it, certainly we can take part in that. So this was the problem that made me think we just need to revisit the ordinance one more time, and probably after the committee they've formed establishes what their needs are. That kind of sums up what their meeting was about and potentially what we could do to help.
Thank you. As I look at, for example, page F10 in the material you sent us, Len, and I look at paragraph 115-7, it looks as though it's almost word for word. I mean, there are some slight differences towards the end. But
Well, I
That's
think initially they were
definition
taking.
of dogs at large, the, go ahead, I'm sorry.
I think they were originally just taking what we had already established. I'm not sure they entirely knew what we had done with the ordinance already. They were just trying to take this and compare it to towing. But in addition, almost feel as if there is a mission statement for them, and I think this helped define what they really wanted to help prevent and then manage at the time. And the dogs at large, they want to make sure, again, that this is being well defined for everybody, because it seems as if they want to take the ordinance pretty seriously.
Were they, to your knowledge, made aware of the proposed revisions that we sent up to the Board of Commissioners?
Yeah, I did communicate the work that we were doing, and as we went through the presentation, kind of highlighted each area that we had been working on or could help them with. So, redefining some of the ordinance, I definitely communicated to them that that was something we were working with. That we would probably try to put on hold so we could get their input as well.
Okay, well, thank you for that. Are there any questions or comments? Dr. Humphrey?
Yeah, I guess the major comment I have is that we only have about 3 months, because April 30th is going to come around pretty quickly, and I'm not sure what alternatives we have other than to modify our recommendations.
One of the things that I already started working on them with was identifying what they could do for their short-term housing. And we established that at any given time, they might have 1 to 2 animals. Particularly, we'll see that dogs, maybe 2 troublemaker dogs get out together, and so they may have 2 dogs at one time. And we've taken the liberty to ask our distributor at the veterinary hospital to see if they can donate 2 large cages for them to house 2 dogs at the facility, at the police station. The other thing that we're also looking at is for 1 cat as well, where there's enough room for that cat to move around within the enclosure and have a litter box. The other thing we're also asking the company is if they can provide a microchip scanner. So just these couple of things alone will hopefully be ready soon enough where they won't be in a lurch when they're headed, normally would have headed to the SPCA. I don't know where they are in their talks with Francisville, but when it comes to June 30th, if there's a need, I know at minimum that I'll be able to lend a hand with those extra animals. And again, it's not like there's going to be 28 all at once, so you know, that's in case of an emergency. Hopefully, we establish who can help at that point and divide up everything nice and equally.
But to Dr. Humphrey's point, the June 30th date, if we were to go back and revisit our proposal, which proposed revisions to Chapter 115, which we've sent to the Board of Commissioners back towards the end of 2010, if we were to revisit that, we could not legally discuss that as a board until the earliest would be the April meeting, and then send any changes on to the Board of Commissioners, which would have to, Mr. Fisher, you can correct me if I'm wrong, which would then have to consider it, and at its first consideration, there would have to be a 30-day waiting period following that before there could be a vote at a public meeting of the Board of Commissioners, which brings us, by my calculations, hard on June 30th. Mr. Fisher?
That's partly correct. I actually received guidance from the solicitor today that any ordinances that are non-zoning only have a requirement of a advertisement of 10 days before they can be adopted. So at one point we were operating under the assumption that all ordinances must have a 30-day grace period from the date of introduction to the date of approval or adoption. I don't believe that's correct. I think according to the charter, according to the solicitor, we have to advertise, we have to introduce, and then we have to advertise the hearing of such an ordinance, and there has to be a minimum of 10 days, but not the 30. I do want to comment that the current amendment to Chapter 115 has not been introduced. So at this point, if you want to make changes to it before we introduce it, you can certainly do so, and there is no requirement in a draft stage to you know, once those amendments are made to advertise those to the public until they get to the Board of Commissioners. So at the stage that they're at the Board of Commissioners, we introduce them. That is when the final draft is made available to the public for comment, and then subsequent advertising occurs, and then subsequent to that, 10 days later, we can actually have a hearing and subsequent adoption, even in the same night. I will certainly check with the solicitor, make sure that's correct, but that's what I'm being told. That is not the practice. The practice has always been we introduce ordinances and we generally wait 30 days until we make the adoption. But that's a practice, not necessarily the requirement. So I don't know if that helps. I just want to make one other comment, that some of these issues that you're discussing right now can be dealt with through an ordinance when they require to be done that way, but they also can be handled just administratively. And it sounds like to me what the police department is facing is an administrative issue and not necessarily one that involves legislation. So while we may need to modify the legislation to match the practice, it may be possible just to have the police take on a new administrative function. And whether that's building temporary housing for animals, stray animals here on site, or finding a partner, like you had mentioned, to house the animals until we can either find the rightful owner or have them adopted. I think presently the animals are collected, they're taken to the SPCA, and apparently we had a process, administrative process, where those pictures of those animals were put on the township website, and you know, the hope was that in a period of just a few days the owners would call the township reporting a lost animal, and then we'd find their home. I don't know if there's going to be a big change here. It just seems like we need a new partner to house the animals on the short term. And then there certainly is the long-term question of what to do. What happens if they're not claimed? What do we do with the animals?
Well, and one of the, again, points that you made is I don't think well, I wanted the ordinance put in front of the commissioners many moons ago. I also think that that's more of a long-term solution, and we can adopt some different administrative policies to manage the animals in the short term. But yes, I wanted the ordinance passed quite some time, but it actually turns out to be good because I would hate to be making some changes now as well. So we are where we are, and I think we can just deal with the short-term situation, and then the long-term will be dealt with by the ordinance.
And I think the subcommittee can continue to work on this offline. And it's not in violation of any of the sunshine laws.
I did have one question about the presentation that I couldn't glean just from looking at the slides, and it was about the difference between licensure and registration. Because we did put a lot of language in around licensure to try and get at some of these issues, but not all, but I don't know what the difference is between the two.
I think it was just the terminology they used. I feel pretty comfortable with saying that. They did a great job on that, but they used a little bit of a different vernacular than maybe we would have.
Because then in that case, it didn't seem like there were a lot of major discrepancies with what we had put forth. It was more parallel alignment, which was kind of nice. It's validated, I think, the approach so far.
Yep, agreed. And I think a lot of what we did also will manage their cat issue too. Because while they focused on dogs, because those are the ones that are more of the problem for storage, they did agree that there was a cat issue as well.
Well, of course, my own view is, and really basically I thank you, Len, for the presentation. But in my reading of it and looking at the proposed revisions that we sent up, as you say, many moons ago, to the Board of Commissioners, which, to be fair, has been wrestling with other issues like the budget and unimportant things like that. But the fact of the matter is, I personally do not see any reason, subject to the meeting of the subcommittee on public health of the Board of Commissioners, which will be meeting right after this one. If anything startling comes out of that, I don't see any reason to defer asking the Board of Commissioners to put this on their agenda and to have whatever the first reading is, and then to vote on it at whatever interval Mr. Fisher comes up with from asking the township solicitor what that has to be, whether it's 10 days or 30, to schedule it for a vote. Part of that process may be the commissioners being swayed by input from other citizens, and certainly that should be part of the process. And that's why we have that process. So that could always happen, and we'll look at that. But I don't personally see any reason to defer the next step in our proposed actions here.
I'll just make a brief comment on that. I think it is a good idea to just move ahead and have this introduced at the Board of Commissioner level. If you decide that there are more amendments that you want to make, we can certainly do that. All of our ordinances are living documents, and it's best to move with what you have. And we did have our hands full when this first came to us in December with the budget process. And now that we have a new superintendent of police in place, William Colarulo, I feel that we have the administrative side that can work in concert with the ordinance and in concert with the Board of Health to enforce whatever ordinance we end up with, and also to help us, navigate the sensitivity of the ordinance and make sure that we're solving a problem and not creating one. So my hope tonight after this meeting is in our subcommittee meeting is to hear from Len, Dr. Donato, and any other member of the Board of Health to just to communicate the value of this change in the ordinance and what it will mean for health and safety in the township. And then hopefully we'll get it onto the agenda at the next meeting. I know our meeting coming up on Monday is already full. I don't know if you've been following our meetings, but we've been going till past midnight, the last couple meetings, and it looks like Monday's meeting is going to be another 5-hour meeting. I may or may not be able to get this onto the agenda as it is, but I will certainly try to get it onto the agenda by next meeting.
Thank you. If there's no further discussion on that item, I'll ask if there's any new business that we can take care of in the next 5 minutes.
I had two things. One is regard to emergency preparedness. On March 2nd, I went to the Delaware County Emergency Preparedness meeting. So it was sort of the usual thing you might expect about just talking about what emergency preparedness is and the different, the points of distribution, the pods versus other kinds of things. And the thing that was interesting about it was that several people, not me, brought up, why don't we have a health department in our county? And and this is related to the next thing I want to talk about, which was about how Montgomery County got their health department started. But anyway, the people running the emergency preparedness, which is SERV, also in Pennsylvania, emergency preparedness is called SERV PA, SERV PA. And so there are county council, and they are not, they're not in favor of a board of a county board of, county health department. They view it as in some way critical of their current functioning. They're quite defensive at this meeting about, well, we're doing fine the way we are. So that was sort of interesting. And the related thing is I was at a meeting of the Pennsylvania Immunization Coalition in Doylestown. It just happened the state meeting was in Doylestown on March 9th, and the speaker for the meeting was Dr. Walter Sue, who's a MD, MPH, and he was the first medical director and also director of environmental health at the Montgomery County Health Department when it was first started. He was also past health commissioner of Philadelphia, and he was talking about healthcare reform, as sort of encapsulating what's happened with it and talking about the likely future implications in terms of what services will be available, how would one access those services, how will those services be paid for. And I think it'd be really great if we could organize some kind of meeting to host him here in Radnor Township. He's testified before the U.S. Senate. He really is quite the expert on it. I would be hard-pressed to ask him to come here to talk to just our small group. I think, really, we would need a sort of larger meeting. So, but I had asked him about, how did the Montgomery County Health Department get started? And he said, well, the commissioners, the council in Montgomery County was in favor of it. And they hired the person who ended up hiring him. So it's sort of a different scenario. But he talked about quite a few people at this immunization meeting were from different health departments around the state, and as part of just his introduction, he talked about what a great thing a county health department is. And part of what he mentioned about that was, when you have a staff of people who live in that county and who are working there and providing services, things happen more quickly. People have more of an investment in making sure that services are delivered promptly and comprehensively. And, just in contrast to sort of waiting for a central health department to allocate, something from their many competing priorities to your specific locality. And he gave a couple specific instances of, meningitis outbreak and getting, vaccine there within a couple hours, to that community, because that's how quickly things can work when you have something that is based in a county. So, and the other thing I wanted to mention about emergency preparedness, there's a statewide emergency preparedness training April 11th to 12th, which I'm going to in Hershey. So I will keep the board informed about what happens there. But the immediate thing in our county is that we need more volunteers, and people can sign up at www.servpa. It's just SERVPA. There's no E at the end of serve. And from that, you can it's quite easy to navigate. You pick your geographic part of the state and what you want to volunteer for. So you can be a medical person, you can be a non-medical person. because our county apparently did very, very well in all the ratings from whatever state agency rates your emergency preparedness, except for the number of people registered as volunteers. And as I said, I realize time is short, but I would think it'd really be worthwhile if we could think of some kind of way to host Walter Sue to come talk, because he's extremely knowledgeable on the subject, and well worth listening to.
But at this point, my sense would be that Walter's best impact might be if he were to schedule himself to testify before the county council, because that ball is in their court at this point.
I meant about healthcare reform, actually.
Oh, okay.
Yeah. And
Okay, if there's no further new business, and looking at the clock, we need to end this meeting. So this meeting is adjourned, and thank you all.